Hi there, I'm Dr. Rose. Welcome in. So, I heard that you got hit in the head. Is that correct? Okay, well, I'm glad that you came in to book an appointment because after getting hit in the head, it's important to make sure that everything is going well, checking your cranial nerves. So, we will get started right away. I'm just going to put on some gloves. Okay. So, do you feel any pain where you hit your head? Okay. How about your eyesight? Anything weird with your eyesight going on? Okay. Well, I'm just going to take a look at your eyes. Usually, the eyes are the best way to tell if something is wrong. So sometimes your pupil might be two different sizes. Sometimes you don't follow the light correctly. So I do have this light here and I need you to follow it, okay? Just follow this light. Good. Does the light hurt your eyes? Okay. Is it hard to follow? Try not to follow with your head, just your eyes, okay? Okay, very good. Can you follow my finger? Good. Now don't pay attention to the light. Just follow my finger. Very good. Just follow my finger. Even when the light is in front of the finger, just follow my finger. Good. Okay. Now I want you to look at the light. Okay. Look at my finger. Now look at my nose. Okay. Now I'm going to be giving you instructions like that. So just follow the instructions. Okay. So follow my finger. Now look at my nose. Look at my finger. Okay. Follow the light. Now look at my finger. Good. Look at my nose. Okay. Look at the light. Look at the light. Look at my nose. Good. Look at my finger. And the light. Very good. Okay. Just look at my nose for now. Tell me when the light leaves your vision. Good. Okay. Tell me when the light enters your vision, okay? Just keep looking at my nose. Very good. Like I mentioned before, you need to look at your pupils, make sure that they're the same size. I have this measurement tool. I just need you to just look at my nose and try to keep your eyes open, okay? Okay, I just want to make sure that they are both the same size. Okay. Good. Just keep looking where my nose would be. I know it's kind of blocking your vision, but just keep looking in the same area. Okay. Okay. So the distance between your pupils are good, and then the actual size of your pupils, I'm just gonna double check. I have this, we're going to be using it, but I just want to check the pupil, how big your pupil is. Okay. Very good. Okay. Okay. So they are a normal size and they are the same size. So that's a very good indicator that there might not be too much going on. just gotta make sure there. Okay, so let me just take this off. Okay. I'm gonna look at your eyes. So just try to keep your eyes open. Okay, don't blink, don't blink, don't blink, don't blink. Okay, you can blink. Good. We're gonna do the other eye. So don't blink, don't blink, don't blink. Don't blink, don't blink, don't blink. Very good. Okay, now you can blink. I'm going to be giving you some instructions when I'm looking at your eyes with this tool. So I'm just going to put this light here again. Okay, so I want you to look up for me. Good. Now look down. Good. Look right. And now look left. Perfect. Okay, and we're going to do the same thing with your other eye. So look up for me. Now look down. Look left. Good. Now look right. Perfect. Okay. That looks really good. We're just looking really deep in your eyes. Okay. I'm going to cover one eye, and I want you to read the smallest line that you can read, okay? All right, you can begin. Okay. Very good. Okay. Now other side, same thing. I want you to read the smallest line that you can read. Okay. Very good. Okay. We're going to cover the same eye. So you can see right here. Okay. I want you to tell me how many fingers I'm holding up, okay? All right, let's begin. Good. Other side. Okay. Can you see my hand? Okay. How many fingers am I holding up? Perfect. Okay. I have these little squares in here that are all different colors. Okay. So I'm going to put a light on one of them, okay? So you got to remember the color. Okay. So you see the colors. Okay. So first we're going to do it without the light. So what color is this? Good. And what color is this? And this color? And this color? Good. This color? And this color? This color? This color. Okay. So now let's look at this one, okay? What color is that? What color was this? What color was this? What color was this? Okay. What color is this? and this color. Okay, what color is this? And this, and this, and here. Okay, here, 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 and here. Very good, yeah. So you did really well with these different colors. Okay, let's do another color test. What color is this? Good. I'm going to make a shape. Tell me what shape that you see. Good. That was a square. I have another color. What color is this? Good. Now I'm going to make a shape. What shape? Good. Okay, last color. What color is this? Okay, good. Now I'm going to make a shape. What shape? Good. That's a triangle. Fantastic. Okay, so your eye health looking really good. Not concerned there. Not seeing any issues. Okay, now we're going to move on with your hearing. I'm going just to take a look inside. Sometimes you can see swelling within your ears, so if you look with an otoscope. So I'm going to look at both of your ears quickly. Just relax. Okay, good. Now let's look at the other ear. Okay, good. Okay, both ears look good. I didn't see any swelling, so that's a good sign. Now we're going to test your hearing. Okay, so I want you to close your eyes for a big portion of this. Okay, so close your eyes. Okay, so I'm going to be using my hand, and you're going to tell me how many times you hear this sound, okay? All right, let's begin. How many times? Good, that was 7. Let's do it again. How many times? Good, that was 5. Again. Okay, that was 10. Very good. Okay, now I have a tuning fork, and this makes this sound. So I want you to tell me when the sound stops, okay? Very good. 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 Perfect. Now I want you to tell me on what side you hear the tuning fork, so either left or right. What side did you hear that? Good. What side did you hear that? What side did you hear that? What side did you hear that? Very, very good. Okay, we're going to do that same thing but with my fingers. So tell me what side you hear that sound, okay? Good. Good. Very, very good. Okay, your hearing is fantastic. There's no issues there. You can go ahead and open your eyes. Now we're gonna look into your face. Okay. I'm just going to take this little hammer here. You're gonna tell me if you can feel that. Okay, I'm gonna be like pressing it up against you. Don't worry, it's super gentle. Okay, so let me know when you can feel it. So you can close your eyes for this one as well. Okay, so close your eyes. Tell me when you can feel the hammer. Perfect. Okay, so I want you to follow my instructions now. So I want you to smile. Very good. Now I want you to frown. Okay. Good. I want you to pucker your lips. Good. Okay. Now can you wrinkle your forehead? Perfect. Okay. Now, let's see. I'm going to use the two different objects. So I have a fan and then I have the hammer again. So you know how the hammer feels, but now I'm gonna brush the fan. Okay, so the fan is supposed to be soft. The hammer is hard. So I want you to tell me which one you're feeling, okay? All right, so close your eyes for this one. All right, so let's see. Which one are you feeling? What was that? Good, that was the hammer. What was that? Good, that was the fan. Hammer. That was the fan, good. Hammer. Fan. Hammer. Fan. Hammer. Fan. Very good. Okay. Now I want you to say ah for me. So open your mouth wide. Okay, I'm just gonna take a look at your throat. So say ah for me. Okay. Very good. Very good. Okay, good. Everything looks good there. So I have a smell and taste test. So I have this here, and this has some liquid. So I want you to just open your mouth and you're gonna tell me what you taste, okay? Alright. What does that taste like? Good. Strawberry. let's do another one. Okay. What does that taste like? Bananas, good. Let's do another one. What does that taste like? Coffee, very good. Now let's do one last one. This one might be a little tough. Okay. What does that taste like? Roses, very good. Okay, now we're gonna do a smell test. So I have kind of the, like, almost the same tool, but this one has a fragrance that sprays your nose. Okay, so let's get, what did that smell like? Good, smell like coffee. Okay, let's do it again. What did that smell like? Roses, very good. Okay, what did that smell like? Bananas, good. Okay, now last one. What did that smell like? Lavender, very, very good. All right, we are all done with your cranial nerve exam. Everything looks fantastic. I'm not concerned about anything at all. But if you do feel like there might be something going on, you could definitely book another appointment or give our office a call. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Bye-bye.